Welcome back. Do you know someone who suffers from sleep apnea? Many of us do, but did you have any idea that affects your teeth and your overall oral health? We have Dr. Preety Desai joining us on the show today to examine the correlation between the two. Welcome back to the show.
Thank you so much.
Yeah, some very interesting information we just talked about on the break in regard to the fact that snoring, you can tell if someone snores by looking at their teeth.
Absolutely. What a lot of researchers are coming out with is the correlation between obstructive sleep apnea, OSA, and bruxism. And we used to say in the dentist, oh, you've got worn teeth and you must be under stress, you're grinding your teeth. That is a total misnomer. It's actually backwards. It's because you are obstructed or snoring or have hypoxic issues, you hold your jaw in a position so that you can get more oxygen at night. And the side effect is it wears the teeth then.
Really?
Yeah, so it's backwards.
It is backwards.
Yeah.
So what are you telling people that have sleep apnea? What are they supposed to do about this? I know there's a clinic at TRU.
Yeah, and that's fantastic. We're so fortunate here, and they're excellent that they will send home an EMG device where you basically measure your airway flow of oxygen to see how many, what percentage of oxygen you're getting through the night. And some people stop breathing literally anywhere from 5 seconds to 60 seconds at one period.
Which can be good for your whole body.
Not good, obviously, for the heart, but the brain. And the brain shuts down very quickly. And so the body's reaction is to move, to snore, to open your mouth to receive more oxygen. So that can be analyzed at home. And different devices can be manufactured. In the dental office, there's over 90 different devices to hold your jaw forward to get more oxygen.
Right.
But that doesn't work for everybody.
Sure.
And then there's the CPAP, which we all know people who carry around the little doggy bag, and it's very arduous to travel with that.
Of course.
Because with luggage restrictions.
Right.
So it's impractical in a lot of situations, and still there's stress from lack of sleep.
Yes. We have pictures as well that I know you wanted us to show, so let's take a look at those.
And so this is basically an x-ray of the head, and when we sleep, the tongue actually falls backwards, and it closes off the airway. Even if you are a side sleeper or more often a belly sleeper or a back sleeper, it will close off your airway if you have that physiology. So that's how we get obstruction. It's your tongue.
Sure. Let's see the next one.
And this is a very typical patient who wears their front teeth because they're trying to bring their lower jaw forward so it opens up the airway because the tongue was blocking it, and they grind on their front teeth. And this is how dentists can tell right away.
Interesting.
Yeah. And this is one of the side effects of sleep apnea too, is that you have this pressure of your tongue on the roof of your mouth, and it indents onto the teeth, and you see these scallops like a seashore, so to speak.
Sure.
And also bone is formed as a result of pressure, and this is where people get something called a torus, which is normal tissue, but it's a side effect of pressure from the tongue. And this is just a pattern of sleep that we all experience over an 8-hour period, assuming we all get 8 hours.
Okay, so those blue bars say REM on them, rapid eye movement.
Those rapid eye movement, and the longer our rapid eye movement, the longer our risk of sleep apnea during those periods. So we were thinking that we were, you know, just moving our eyes and flickering or little twitchy movements. We're actually not sleeping during that time, or not breathing during that time.
Interesting.
Yeah.
All right.
And this is just another patient who not only wears the teeth, but they actually have spacing between their teeth. So their chief complaint when they come into the office is, I want veneers, I want to fix this. But if you are grinding your teeth, you're going to pop off those veneers without taking care of the problem.
Right.
Which is much more deep-seated. So you got to spend the money to get beautiful veneers once everything is under control.
Right, everything else has to sort of be in place first.
And just another wear pattern. These are just different looks of people who are all obstructed.
Yeah. So the message that you're sending out today is if you have sleep apnea, you need to really get that under control because it's having probably more than just an effect on your mouth, but it definitely, that's one of the big ones.
It's more health-related, chronic illness, rheumatoid arthritis, heart disease, hypertension. It's been related to children of SIDS death, bedwetting, all these things. They start right from childhood.
Wow.
And we just see the signs later on in life when people come in, they want veneers. It's like, this is long-seated.
Sure. Very interesting. Very interesting topic today, Dr. Desai. Thank you very much.
Thank you.
If you would like to learn more, if you think that Dr. Desai might be able to answer some questions for you after our discussion today, the information is on the screen, kamloopsperiodontists.com, as well as the phone number, 778-471-6001. We're back after a quick break. Stay with us.